I am pleased to introduce our first speaker, Dr. Olivia Lee, an assistant professor at the USC Suzanne Dworak-Peck School of Social Work. Dr. Lee seeks to disentangle a complex relationship among socioeconomic status, adverse childhood experiences, and behavior health, particularly substance abuse and its comorbid mental health during the life course and across generations. Please welcome Dr. Lee.
Hi, I'm Olivia Lee. Thank you for joining us today. I'm really thrilled to be here. And I will open up this conference, Next Generation Social Work Conferences. Next slide, please. And today in my little talk, we'll talk about the three things. The first one is the scope of addiction problems in the United States. And the second one is a social work approach. My take on what is a social work approach to addiction problems. And the third one is a couple of example studies, and then we'll have a Q&A. Next slide, please. So the first one, we'll talk about the scope of addiction problems. Next slide, please. This one is from National Survey on Drug Use and Health, which we often call as NGSW. And NGSW is a national surveillance data source showing where the nation stands in terms of drug use. This one is a 2018, the data source. If we will look at this one, alcohol problem, 80% of US population age 12 or older say they're involved in alcohol. And I want to point out the cigarette use. This one is often called as a #1 killer in terms of substance use problems. About 55% of the United States, the population say they're using cigarette to some degree. And also illicit drug use, 50% of the population in our country say they have used illicit drugs, one type or the other. This one is showing us substance use problems are quite prevalent in our society. Next slide, please. And now this one is we are looking at specifically youth. In a previous slide, we have looked at the scope of addiction problem in our nation at the population level. And we learned that it is a quite prevalent problems in our nation, in our country. And when we look at the youth, that prevalence, the high prevalence is not going away. If you like, let's point out, I'm gonna point out a couple numbers here. 8th grader, about 20% 8th graders say they have used alcohol. And if we move the 12th grader, they say about 40% of 12th graders say they have used some sort of illicit drug use. So again, this one is telling us is quite prevalent. Substance use problems are quite the prevalent in the population and the youth as well. Next slide, please. So the consequences of such prevalent substance use are literally fatal. Thousands of Americans have lost their lives in relation to the drug overdose. The trend is showing an increasing pattern. In 1999, it's under 20,000 people lost their lives related to the drug overdose. But in 2019, now we have over 70,000 people, their lives due to drug overdose. So this one is telling us underscore the importance of understanding the substance use problem and do something about it so that we can protect the public's life. Next slide, please. Then the next question that we're going to wrestle with, how social work approaches this problem. This is a really highly prevalent substance use problem. Are there any uniqueness to social work approaches? That is the question that we're going to navigate together next. Next slide, please. If we ask this question, what is the unique features of a social work approach to the addiction problem, you may get a slightly different answers from different people. This is my take on, based on my observation, what are the kind of key characteristics that I see in our social work approach to addiction, the problems. I would say there are 4 key characteristics. The first one is a social justice, and the second one is a LifeCourse perspective, and the third one is ecological perspective, and the final one is prevention to treatment. So I'm gonna have the brief comment about each one. Next slide, please. The first one is a social justice. This is the first and the foremost important aspect that social workers bring to the table of solving addiction problems. That is a really social justice. We are disciplined that we anchor ourselves within this value of a social justice. It is incredibly tricky to define what a social justice really means, but it's the simplest term we can define in a way, fairness in the way that people are dealt with. And particularly to me, and based on, again, my observation, we social workers constantly reflect on one critical aspect of social justice, which is distributional justice. And again, it's defined, what is the definition? It is tricky, but a definition is like this: to what society owes the person regarding the distribution of societal resources. If we apply this notion of social justice to addiction problem, this can be translated into disparities in stages of addiction problems and the recovery. Vulnerable members of our society experience more addiction problems, more limited access to services when they have addiction problems, and do not have resources to maintain addiction-free stages. So that's where the social workers coming in. We are wrestling with this disparity and inequality in addiction problem and a recovery. Next slide, please. And then where the vulnerability coming from? The vulnerable members, I mentioned that one. Reflecting on various groups of socioeconomic identities will help us get more concrete sense about it. Having a membership to a certain social group, for example, being born to low-resourced families, may increase kiddos' probability to get more exposed to drug use problems in their own families or their neighborhood. So that's the one, how we're gonna get at this disparity, the issues. Next slide, please. Next two are there related in my head. I'm gonna talk about LifeCourse perspective and ecological perspective. Next slide, please. So LifeCourse perspective, in essentially, when we see anyone's substance use problem, the clients who are struggling with a substance use problem in front of us, we are seeking to see the connection from childhood across the life course, not just isolate that moment. We are looking at connection and whole kind of thing. What happened in earlier developmental stages will have implications for later substance use problem. For example, we may work with a client's young adult client who is struggling with drug problems. One of the reasons might be why the client is struggling with a drug problem is potentially related to childhood adversity that they experience as a child. Then our approach, how we're going to solve and help this client will need to be trauma informed. Next slide, please. Ecological perspective is now we are contextualize the one's life course, how that substance use problem, drug addiction problems are coming out within the higher ecological context. We're thinking about family connection. We're thinking about peer influences. We're thinking about school. Do we have resources and a whole kind of thing at the school or the community level? Or in a society, at the society level and a policy and whole things like that. Next slide, please. Final pillar in my head and our social work approach is the working toward not just the treatment, but toward prevention as well. So given that we're anchoring our approach to the addiction from the LifeCourse perspective, we're helping clients who are suffering with a substance use problem right now at the moment, but also we have our eyes on how to prevent substance use problem from happening from the get-go. Next slide, please. We can move on to next one, please. So we talk about the 4 pillars of the approach, social work approach to the addiction problems, 4 different ones. And now I want to give you a couple of examples how that can be really actualized in a study, in a social work, the science toward the addiction problems. Next slide, please. We can move on to next one. Okay, here, this is one of the studies that I have led. Here I'm looking at unemployment and childhood poverty and young adult substance use problem. In this study, what we have really looking at, and we talk about at the beginning when I was talking about the pillars, the characteristics of our social work approach to addiction problem, I talk about the vulnerability, the disadvantaged, the population. Here I am looking at low socioeconomic status. Employment status is one of the key feature of feature of status. And then I'm linking current young adults unemployment to their childhood, childhood poverty. So the accumulation of that disadvantage, from a perspective of socioeconomic status, how the one is influenced on current young adult substance use problem. Next slide, please. And what we have found in the study is that my unemployment status as a young adult has the influence on my substance use problem. But if I'm coming from low resource family, if I spend my childhood low income and poverty, then they will have bigger impact on my substance use problem. Next slide, please. This is from a perspective, ecological perspective. I talk about when you're thinking about substance use problem, we're connecting the different ecological domain. This one is specifically connecting the family. Next slide, please. So here, what we have done, what I have looking, and this one is led by my colleague Julie Sitterbaum. She's the faculty member at our school as well. We have looking at the relationship from G1's substance use that has impact on G2's substance use and a whole mechanism in there. And G2's substance use has impact on G3's substance use, specifically cannabis use. Those are the few examples of how that characteristic of the social work approach to addiction problem can be actualized, at least in my head. Alrighty, that's it. That's what I have. And then any questions or anything, I love to have a conversation. Alrighty, I'm gonna looking it up here, the chat box. Give me. What has surprised me? What are really the interesting and exciting question? So what has surprised me is 2 things. One is that the connection, the addiction problem is not like isolated, standing alone, it's not like that. But the addiction problem is really interconnected with this disparity. And what is going on, this social, the social inequality, what is going on, that one really has influence on this addiction problem. That was one thing. And the other one is when we are working on addiction problem, even though as a social workers, we have a unique perspectives and everything, we gotta work as a team. That transdisciplinary, we need the psychologists, we need a pharmacist, we need the doctors and nurses and whole thing and working together. That's another one that has surprised me. Okay, I'm going to move on to next one. Social work such a, I'm going to read these questions. I don't know, you can see all the question. Next question I see is, what do you think makes a social work such an important part of transdisciplinary approach of addiction science? That one is, to me, is a social justice. We bring the social justice perspective to the table. And we also bring this broader perspective, not just isolated individual, like separately, but looking at it holistically. And also the other one is looking at the influences that can come from different ecological domain, like families and peers and the schools and everything. That's another one I would say is a really important part of transdisciplinary team to the addiction science. Next question is, again, I'm going to read it just in case you cannot see it. If someone was interested in focusing their career in addiction science, where should they start? What an excellent question. What you can do is that the studying, like understanding what is the scope of problems and a whole kind of thing. But the other one that since we're talking about social work, the other one is, I would say, you go out in the field as a volunteer and see what is going on out there. And then that's going to give you a lot of fresh perspective, and you will see what is unmet service needs out there in the field. And then when you come to the school and to learn about this substance use problem and what are the factors feeding into substance use problem and a whole kind of thing, then will click really well for you. And then it will be kind of the two-way learning. You learn what is going out there in the field, but also you learn what is academically we know about these addiction problems. Okay, so next question is, how much would customizing addiction treatment and recovery problems improve sustainable outcomes for individuals with substance use disorders? That's yet another really the interesting and important question. Customizing and tailoring the addiction treatment and recovery program is absolutely important, because we know as a social workers, we know there is a foundation, there is evidence-based practice. Absolutely, we want to navigate and thinking which one has been proven, has shown evidence that this one is actually working, though or not. We can have that one, but at the same time, each individual, the people are so different from each other, so that you don't want to saying that this one thing is going to fit everybody, and this one can help everyone. We don't want to assume that absolutely. So we definitely want to customize in a way, is tailored in a way that is working for the specific, the individuals. Okay, if you have any more questions, please chime in. I love to hear or comments or anything. I love to have this one to be more interactive as much as we can. Where do you see the greatest promise in addiction science? This is really big question. Greatest promise in addiction science. I would say I see the one in many different domains. I don't know, I can pinpoint which one is the greatest promise in addiction science, but what we can see is that where we're going, this addiction is going, is the more holistic approach, not isolate a single one or a single aspect from the individual's situation or nothing like that, but more like a holistic approach and looking at where we are going and where this problem is coming from, and whole thing. One thing that I want to mention is that in a recent addiction science and what is happening in treatment and prevention and whole thing, one thing that I see a lot is trauma informed. Since as a social workers, we know we have worked with a lot of clients who have a lot of trauma, either as a little one or as growing up, there is accumulation of a trauma. So because of the accumulation of trauma that can have triggered the substance use problem. So I think addiction science are moving toward like incorporate that trauma aspect in it so that we can navigate and we can tailor this existing intervention strategy more and stronger and more effective for clients that we're looking at, where we're working with. Alrighty, next one is, how did you get into social work and how did you come across the discipline of addiction science? And it's another good question. Okay, how did you how did I get into social work? That is a kind of going back to one of our question about what I would recommend for you to start, where to start when you are interested in addiction, the problems in addiction science. Is the way that I started is I worked as a social workers. And before I worked as a social workers, I volunteered and I did a social work intern and a whole kind of thing. And then you see what is out there, what is going on, and a whole stuff. And one of the things stuck in my mind as while I was working with my client is that this notion of substance use, people are using a drug, and because of that, they are poor. That I am simplified that discourse this way, but there is that essentially what they have, either substance use problem or the low socioeconomic status, low income, losing their job, and the whole thing is because of they're using so much drug, and they're using so much drug, so they're losing their job, and because of that, their socioeconomic status is getting lower, and because of that, their children are suffering. And then in the field, I see that is not the case. It is really not the case. Our clients and my clients, when I work with them, they're doing their really best. And they're trying to make it work and a whole kind of thing. And the substance use problem, we cannot say that substance use problem is the source of their low income or whatsoever. It is more the other way around. So I want to fight against that notion that people using a lot of drug and because of that, they're falling into poverty. I want to fight against the notion. And that's why that I got into the social work, because as I say, social work is the notion of that the anchoring point of social justice, and then fighting against the stigma around this substance use and the relationship between the substance use and the socioeconomic status. That one. That's how got into the social work. And how did I come across the discipline of addiction science is because I have that one in my heart. When I entered the NGSW, I was seeking the opportunity. I was looking for the opportunity. And after I got my PhD, I was at the research center as a researcher. And then research center, we had a lot of substance use related. The study is going on, or intervention strategies are going on, and a whole kind of thing. So that one was that's how I come across the discipline of addiction science. And as I get into more and more into the addiction problem, I started collaborating with many people, many disciplines, as I said, across many disciplines. That's how I ended up being here. Okay, how is addiction science different from substance abuse? Okay, so addiction science and substance abuse. Addiction science, I would say, is include substance abuse. Addiction science, in a sense, is that trying to solve the substance abuse problem and drug addiction problem. So substance abuse, the word abuse, and addiction, they're not exchangeable, but at the same time, they're definitely related to each other. Okay, we have 3 minutes. Oh, there's one more question. What advice would you give for someone looking to get started within addiction science? So that my suggestion would be really, you want to go out in the field. That will be the first one. And coming to the conferences like this, or out there, there's many conferences, and the the information out there, there will be the good one as well, so that you see what is up, what is a unique approach, and a whole kind of stuff. The other one is I would really, really encourage you to go out in the field. If you are in the MSW program currently, then when you're looking for internship, seeking out the internship with an emphasis on the substance use problem. And if you are not pre-MSW and just entertaining, navigating the different options and whole kind of thing, then I would say go out and volunteer and the different social work agency so that you can get exposure. So two-pronged, I guess, in a sense. One is go out really in the field, work with the clients, get experience, trying to understand their life, that one. And the other one is that the going out to conferences, and there's many other conferences which has a lot of emphasis on the substance use. So going out and seeking out those conferences. Alrighty, so I think we have 2 minutes left. Let me see if there's any other question. Okay, so I'm gonna wrap it up. Looks like that we're good. So I'm gonna wrap it up. Thank you so much. It's I love to see your face. It is interesting to, I'm just behind somewhere, you are there. And someday, hopefully I can meet you. The addiction science definitely needs you, who is passionate about the social justice and the disparity and a whole kind of angle. And hopefully this one gave you, my talk and this conversation Q&A gave you idea what is the addiction science specifically within the context of the social work, what is the unique characteristics that we navigate as a social worker in relation to the substance use problem and addiction problems. And if you have any questions, please feel free to reach out to me. My name should be at the school, the website. Anyhow, thank you so much. Thank you so much for this opportunity to connect with you via online. Thank you.
Thank you so much, Dr. Lee, for sharing with us and having such an engaging conversation.